17 causes of lower back pain. If you don't know the cause, you could end up endlessly visiting osteopaths, manual therapists, neurologists, and eventually find yourself on a neurosurgeon's table, where they'll operate on you and remove that hernia. Be sure to watch this video until the end, and I'll show you one exercise that will help you quickly and significantly increase the arch in your lower back in the shortest possible time. If you went to an osteopath, a manual therapist, or even a neurologist with your pain and it helped you for a while, then of course it's not a mistake to go, because the person has to start somewhere on their path to health. But very often, doctors simply overlook the fact that there are always many different causes. Pain is always a combination of factors coming together at a single point. This is something you need to be aware of. The issue could be chronic inflammation of the intestines, because the mesentery of the intestines themselves, are completely attached to the lumbar spine. It could be flat feet, and you may have a genetic predisposition to flat feet. If your gallbladder isn't functioning well, then vitamin D isn't absorbed properly. This means your bone and joint system will suffer. What will happen then? There will be extra stress on the feet, and flat feet will develop. From a very early age, when children start crawling and walking, for some reason people put shoes on them. We haven't come that far from the upright human who was still running through the forest just a few thousand years ago. Accordingly, from an evolutionary perspective, especially in childhood, we need to walk barefoot as much as possible. The biomechanics of the foot are such that there should be constant rolling motion. When you put shoes on, well, you could say you're giving the child a cocktail.
No! God, please, no! No!
It might seem like I'm switching to a completely different topic again, back to childhood, back to shoes and feet, right? But just imagine that these feet start to stand crookedly. What happens then? There's an overload on the knee joint, right? Okay, let's go further. Here are overloads on both sides of the knee joint. This is how a person walks. As a result, the overload travels up the chain to the hip joint and overloads the entire musculoskeletal system. Naturally, this affects the lumbar region and really our entire spine and even the neck as well. Therefore, a child, or really anyone, should devote as much time as possible to this and walk barefoot. This is very important. If you like walking barefoot, give this video a like. We're moving on to the next reason. And the third reason is our kidneys. A patient came to see me, an emergency case in the admissions department, while I was on emergency duty. She was having an acute attack of pain in her lower back, with radiating pain down her legs. In other words, shooting pain along the sciatic nerve. In just 2 minutes, I performed a manual technique to lift her kidney, and her pain disappeared right then and there. It's a miracle. The kidneys are probably the only organ we have that is not attached to the skeletal vascular system but hangs from our blood vessels. And it hangs there twisting around. So what happens? Low blood pressure. What do the blood vessels start to do? The vessels start to sag. The kidney begins to drop. When the kidney starts to drop, it puts pressure on the organs located below it, either on the right or left side. What happens then? Swelling begins to form in this area. The tissues start to swell and the lower back begins to hurt. Usually this is a muscular pain, typically either on the right or the left side. The next reason, many manual therapists say this accounts for 50% of lower back pain cases. It's a spasm of the so-called iliopsoas muscle, or psoas. It's actually amazing, but very few people know about it. This is the first time I'm hearing about it. This is a muscle that starts from the inner surface. It attaches to the femur and extends up to the 12th thoracic vertebra, meaning the thoracic section of the spine. These are huge muscles that keep our body stable. Some even call this muscle the muscle of our emotions. It can be to a slightly lesser degree or even on par with the diaphragm, involved during our emotional outbursts or stressful situations. This muscle tightens up. And now just imagine, stand in front of a mirror and take a look at yourself. Does your lower back hurt? And look, one shoulder will be lower, the other higher. And the spine, that is the pelvis, one side will be higher, the other lower. It will look like this. Here the shoulder is lower and here the pelvis is higher. And this, with the highest probability, tells me that the person has a spasm in this very psoas muscle. The fifth cause of lower back pain, especially when bending backward, is the displacement of the fourth lumbar, vertebra slightly forward. Scientifically, this is called anterolisthesis. This usually happens in pregnant women and after childbirth. Women walk around, yes, and then they constantly carry their child, loading their spine, their lower back in this way. And even the slightest displacement like this leads to swelling, compression of the nerve roots, in other words, pinching of the nerve endings, and the development of this constant pain. And by the way, this problem also occurs in overweight people who rapidly lost weight and then quickly gained it back. That happens too. And another group of people who experience this problem are those who do deadlifts. That is, professional athletes, professional bodybuilders. Let's move on to the next cause, and that's our diaphragm, our beloved diaphragm, which becomes spasmed due to stress and all sorts of things. First of all, the diaphragm is also attached to the spine. It attaches to the ribs, attaches to the spine with these tiny little bundles. By the way, it attaches to the spine quite firmly, quite strongly. So what does diaphragm spasm lead to? It leads to instability in the thoracic spine. And this, in turn, will be transmitted down the chain to the lumbar spine, causing pain syndrome. The seventh cause is displacement in the atlanto-occipital joint.
What's that?
Many of you have probably heard about atlas displacement, about atlas correction. So give this video a like if you've heard about it. Now I'll explain how this affects the lumbar spine. This is the joint between the atlas, the first cervical vertebra, and our skull. The atlas sits on the skull like this. Accordingly, even the slightest changes in its position, one way or another, can lead to pain along the chain. This applies to both the cervical and lumbar regions of the spine. The eighth cause is the contraction of the dura mater. What is the dura mater? By the way, do you know what it's called in Latin? In Latin, it's called dura mater. That's actually where the word dura comes from. Basically, they just added the letter K and started saying it that way. It's a membrane that covers our brain and spinal cord with a kind of transparent web-like layer. And now imagine that this thin, transparent membrane, on one side due to a spasm of your iliopsoas muscle, or maybe because of an atlas displacement, or the atlanto-occipital joint is twisted, maybe a child or an adult slept in an awkward position, and this membrane, the dura mater, gets crumpled on one side. You can check this as follows. The person lies down on a flat, completely hard surface, and you look from the side to see if their shoulders are level and if their pelvis is at the same level. And usually it turns out that, for example, the pelvis sticks out forward on the right, while on the left it drops down, and the shoulders as well. On the contrary, one shoulder is higher, the other is lower, and that's how a person walks around. Why am I constantly drinking water?
I have no idea.
Imagine a swamp and a mountain river. Where is the water cleaner? In the mountain river, obviously. Definitely not in the swamp. Why? Because there is constant circulation of liquid. It's the same with us. And so accordingly, when a state arises, the lymph starts to become acidic because it contains a large amount of cortisol, the stress hormone, which isn't evacuated due to the lack of circulation. And what do these stagnations in the lymphatic system lead to? Edema develops. And these edemas might not even be visible to the eye. The most obvious sign, you can look at yourself in the mirror in the morning. If you have bags under your eyes and your lower back hurts, then you clearly have a lack of fluids in your body. By the way, that's why your face is puffy after drinking alcohol, after a night of drinking. Why is that? Because when a person drinks alcohol, and alcohol is one of the most powerful dehydrators, meaning substances that draw out water and cause it to be retained in the body, it shuts down the systems responsible for removing water from our body. Water accumulates, and so in the morning a person wakes up completely swollen. You can find practical applications of this knowledge on my Telegram channel. For example, you'll learn how much fluid you need to drink throughout the day so that this circulation happens properly. And I explain everything there scientifically, with references to scientific publications, only evidence-based medicine showing how it works. I'll leave a link to my Telegram in the description, so go ahead and subscribe. And the 10th reason, which only occurs in women and concerns women, is uterine displacement. Uterine displacement happens, for example, in cases of hypotension, in young girls, in slender, thin girls with low blood pressure. The ligaments that support our internal organs start to sag, and the uterus sags and shifts as well. As a result, it starts to put pressure on neighboring organs. Whether it shifts to the right or left, it presses on the pelvic organs. There are large veins running through that area which start to get compressed, and this again leads to the development of what? Swelling. And this swelling in turn provokes pain in the lumbar region of the spine. The next reason, again, brings us back to psychosomatics or somatopsychics. It's the spasm of these tiny intervertebral muscles, which act like a chain reaction. So one muscle spasms and the spine shifts slightly in one direction, right, left, down, or up. What happens then? On that side, the nerve roots get pinched. Immediately the body reacts. Oh, something's pinched there, so things aren't flowing out properly. Things aren't flowing in properly, which means swelling develops. And this small localized swelling causes those painful sensations in the spasming intervertebral muscles. Yes, and this spasm occurs again for two main reasons. A stressful state, that is acute stress turning into chronic stress, and chronic inflammation, usually chronic inflammation in the intestines, which leads to pain and the formation of hernias. The 12th reason is increased viral activity due to weakened immunity. We have 30 trillion cells. And do you know how many microorganisms live on those 30 trillion?
No.
300 trillion. That is 10 times more than our own cells. So now the question is, who are we? Who am I? You are a human, yes, which means a collection of cells filled with an exoskeleton or endoskeleton with water, with fluid in which float, hang around, on which, in which, under which, basically everywhere, there are just 10 times more various microorganisms. And of course, our viruses stand apart from all of this. Look, there is a group of viruses called the herpes group viruses. This is not just the herpes you get on your lips. It also includes the urogenital virus, meaning the genital virus, cytomegalovirus, and the Epstein-Barr virus. Accordingly, increased viral activity leads to a decrease in your immunity. And conversely, a decrease in your immunity leads to increased viral activity. Because herpes group viruses, well, 95% of the world's population are carriers of herpes group viruses. We need to understand this. These are resident viruses that come to us almost with our mother's milk, that arrive in the very first days or months of life and stay with us forever until the end of our lives. There is absolutely no way to remove them from our bodies, and there is no need to do so. You just need to monitor the state of your immune system, boost your immunity, no matter how cliché that may sound, and then that's one less reason for pain in the lumbar region. An inflamed intestine is the cause not only of biomechanical damage, biomechanical contraction, and problems with pain in the lumbar spine, but also a number of other issues, including problems with the immune system, frequent illnesses like tonsillitis, laryngitis, and anything else you can think of. All of this is, in one way or another, connected to our nuclear reactor, our intestines. You can learn about all this and much more in my free webinar. The 14th topic is scars on the body. You know, honestly, I'm even ready to show my own scar here and explain how it personally caused me a lot of problems. I constantly had these, very localized pains in my lower back, right in the area where the muscle runs next to the lumbar region, the so-called paravertebral muscles. That spot was always hurting for me until I got to the root cause. And do you know what the root cause was? A scar from an appendectomy. I had my appendix removed when I was 2 years old. And I had a rather neat, small little scar. The surgeons operated on me and they did everything well. And by the time I was about 35, I started having these constant pains in my lower back. I realized that my scar was pulling on this fascial sheath, the fascia that covers us from the inside, so to speak. It's also, like a very thin, delicate mesh. When you cut meat, that thin film you peel off, that's fascia, right? This fascia is also called the body's inner vision or inner eyes. Now look, there's a scar, right? And this scar is attached to the fascia. So if you pull on the scar, there will be a little indentation there. This scar attached to the fascia means that the fascia is sending signals that something is wrong there and starts to overstrain other areas. It sends a signal for other muscles to become more tense, to contract more, while others relax. And this creates an imbalance. If we look at our pelvis, for example, if I have a scar here, then just like that, I already have pain over here. When you start working with a scar, I've already treated so many patients this way, you start working with the scar, and gradually, little by little, the pain goes away. And this face starts to move and function properly, and the muscles begin to work. Yes, and now we move on to the 15th reason. This is a large amount of visceral fat. This is actually kind of funny. A person can look skinny but have a huge amount of fat where our internal organs are located. It surrounds them. And this is pathological fat. There shouldn't be a lot of it under normal circumstances, just like with subcutaneous fat tissue. Of course, there are different body types. At the very least, we can divide them into asthenic, hyposthenic, normosthenic, and hyposthenic types. But it's important to understand what does a large amount of visceral fat lead to chronic inflammation. In other words, a large amount of fat is directly linked to chronic inflammatory processes in the intestines. Again, right? It's all a vicious cycle. The 16th reason, once again, we're coming back to our favorite gallbladder, to our bile acids. Improper functioning of the gallbladder leads to fats are not properly or fully emulsified, meaning that fats are not broken down into these micro, like that spray alzol for burns, that kind of remedy. When you use it like this, it turns into a foam, right? Our fats need to transition into this aggregate state, into the state of this foam. That is, it's a very, very finely dispersed fat structure. And it's exactly these that are the transporters, meaning the vitamin attaches to them, dissolves in them, and is then absorbed in our intestines. Accordingly, if the gallbladder isn't working properly, the musculoskeletal system suffers. And the 17th reason is the so-called pubic symphysitis. Who does it occur in? Usually in women after childbirth. What is pubic symphysitis? Here is our pelvis, right? Here it is, the pubic symphysis. When the baby passes through the birth canal, what happens? The pelvis opens up. And right here, this little ligament, the symphysis, it moves around. And if the baby is large or the mother's pelvis is small, like this one here, then accordingly, the baby pushes through here, stretches it, and small tears occur, which leads to constant pain and inflammation. People do all sorts of things to get rid of the fetus. How is it checked? It's checked like this. You simply place your hand on the abdomen and press on these bones, and there will be pain on one side. Now I will show you an exercise that will increase the arch in your lower back in just a couple of minutes. What will this do? This will relieve swelling in the lumbar region of our spine. And the arch in your lower back will increase right here and now. Now, to demonstrate how this technique works, I've asked our cameraman Valerie to participate. Valerie, what do you need to do now? You need to, with your legs straight and without swinging, simply lower your hands down as far as possible without bending your knees. As far as you can, no swinging. Okay, that's it, stop. You're not reaching the floor. How much space is there? About 3 to 5 centimeters left, right? Okay, 5 centimeters. All right, now let's do the technique. Let's go. To perform this exercise, this technique, you'll need an assistant. What do? We ask them to stand up and arch their lower back, like this. Good. We take an ordinary cork from champagne, from wine, whatever you have. Actually, in my own practice, I even just use a simple wooden dowel, a wooden cork like this. And now what do? Right where we usually wear a belt, there are these spots, sometimes called venous dimple. People often have little indentations here. So what do? We bend the right leg while the left stays straight. So the right leg is bent, the left is straight. Place it on the left, with your right leg bent, put it on the left side and tap like this. Keep tapping further. And tap this whole area, don't be shy, about 10 times. It should be right on the edge between pain and no pain. In other words, it shouldn't actually hurt. If it hurts, then we stop immediately, because that means the processes are already quite serious, so you shouldn't do it. And we've tapped along the left side of the spine in the lumbar sacral area. We've tapped, now straighten this leg, bend the other one, place it, and again ask, does it hurt or not? No, it's tolerable, right? We also tap about 10 times at each point, or move slightly to a new spot. We keep tapping. And with these vibrating movements, we stimulate the flow of lymph, the lymphatic system, the movement of our body fluids. Now let's see what results we've got from this. Valerie, return to the starting position, the initial position. And try to bend forward. 1. That's it. He reached his toes. Yes, all the way to the floor. Excellent. Contraindications for this technique include various acute inflammatory processes. That is, if a person has a high fever or if they are experiencing severe acute pain in the lower back, it's better not to perform this technique. Then you must receive clear feedback. You need to make sure that your client, patient, or the person you are performing this technique on is not experiencing pain. In other words, the strikes should be very gentle, right on the borderline between painful and not painful. That is, under no circumstances should there be any pain syndrome. If you start tapping gently and notice that there is pain, you must immediately stop performing this technique. And this was one of the techniques that I teach in my manual therapy courses, in my signature courses, as Dr. Mazgutov. There is a free webinar that you can attend. Get acquainted, in general, with the principles of how our body works, what underlies it. I'll give a little spoiler. At the core is our lymphatic system. How to work with it, how to help people get rid of a huge range of various problems, from pain syndromes to swelling, stagnation, even psoriasis, and so on. It's just a wealth of information you won't find anywhere else.